Chronic pain can lead to central sensitization, where the nervous system becomes hypersensitive. This means that pain may persist even after removing endometriosis lesions surgically. There are three types of endometriosis pain: nociceptive, nociplastic, and neuropathic. It's important to identify which one applies to you so that you can tease apart whether this may be an explanation for why your pain didn't improve post-operatively. You've undergone surgery for endometriosis, hoping for relief, but the pain persists. Why? If you can relate, I can too. It's an unfortunate reality for so many people with endometriosis. We wait years to find the right surgeon. We get the surgery with every positive expectation and hope in the world, and then whap whap. In this video, we'll explore 6 reasons why endometriosis surgery might have not alleviated your pain, and we'll provide actionable steps to address each of these issues. If you haven't already, please give this video a like, share it with a friend, and hit that subscribe button if you haven't already. So the first reason why you might be still experiencing pain after endometriosis surgery is that you had ablation surgery instead of excision surgery. Ablation, also known as cauterization, uses heat or other energy sources to burn off the surface of endometriosis lesions. While ablation can relieve symptoms temporarily, it doesn't always address the deeper layers of endometriosis tissue, so the relief may be short-lived, if you're even getting any relief, and the risk of recurrence is higher. Additionally, ablation introduces more scarring and tissue damage. Endometriosis can continue to grow and worsen under the scar tissue that forms from ablation, often resulting in more severe symptoms. Systematic reviews gauging symptom improvements from ablation versus excision show that excision surgery results in a significantly greater improvement in pain with periods, pain with passing stools, and pain with intercourse compared to ablation surgery. Recurrence of endometriosis symptoms beyond 12 months was also less with excision compared to ablation surgery. Excision also tends to be more complete in that the surgeon can access and remove endometriosis from delicate structures like the ureters, uterosacral ligaments, bowels, bladder, and major vessels, resulting in a more complete surgery. So some action items that follow from this reason include reviewing your surgical records to determine if the procedure performed was in fact an excision surgery. If ablation was completed and symptoms persist, consult a specialist about the possibility of excision surgery. I have a comprehensive post on Instagram, which I'll link in the show notes below, that highlights some experienced surgeons accessible worldwide. You can reference this for some support in accessing a knowledgeable and experienced surgeon. Reason number 2 that your pain may have not improved post endometriosis surgery is that your pain is driven by nervous system dysfunction. Chronic pain can lead to central sensitization, where the nervous system becomes hypersensitive. This means that pain may persist even after removing endometriosis lesions surgically. There are 3 types of endometriosis pain: nociceptive, nociplastic, and neuropathic. It's important to identify which one applies to you so that you can tease apart whether this may be an explanation for why your pain didn't improve post-operatively. Nociceptive pain is when something is physically present and causing tissue injury or damage. So imagine a hammer against your finger. If you remove the hammer, you remove the source of the pain. In these cases, excision surgery tends to provide great relief. Nociplastic pain is pain stemming from centralized pain from dysfunction within the nervous system. It can be caused by years of inflammation, sensitizing your system to pain and generating pain, whether or not tissue injury or damage is occurring by some physical stimuli. With this type of pain, excision is less likely to help, but it's still worth doing. And neuropathic pain is caused by damage or compression of a nerve. Excision surgery absolutely can be helpful for this type of pain, but how much it's going to help you ultimately depends on if the damage to the nerve is resolved with the surgery. Okay, so the action steps to consider if you suspect that this may be a reason for why your pain persists post-operatively include considering therapies like cognitive behavioral therapy or mindfulness to manage central sensitization. Applications like Nerva or the Calm app can be helpful with consistent use as well. You could consider consulting a pain specialist familiar with endometriosis-related central sensitization. There are also several nerve-specific supplements like alpha-lipoic acid, acetyl-L-carnitine, and PEA. Alpha-lipoic acid is an antioxidant that reduces nerve inflammation and can be taken in doses of 300 to 600 milligrams daily. Acetyl-L-carnitine can help with nerve repair and mitochondrial support. Typical doses are around 1,000 milligrams daily, and PEA is a powerful tool for neuropathic pain taken in doses of roughly 400 milligrams daily. Reason number 3 that your pain persists postoperatively is that your pain is caused by pelvic floor dysfunction. Endometriosis can cause pelvic floor muscles to become tense or dysfunctional, leading to ongoing pain. This cross-sectional study showed that women with deep infiltrating endo who presented with more pelvic pain, pain with intercourse, painful bladder symptoms, and painful urination also had higher pelvic floor muscle hypertonia comparatively to women who do not have or who did not have deep infiltrating endometriosis. Pelvic floor muscle hypertonia is abnormal muscle tone that causes stiff muscles in the pelvis. They were also shown to have weaker pelvic floor muscle contractions and incomplete pelvic floor relaxation compared to the women in the study who did not have deep infiltrating endometriosis. Muscle length of various leg and pelvic muscles were also reported to be abnormal, which can also increase dysfunction in the muscle tone and stiffness of muscles, contributing to pelvic floor dysfunction, specifically in people with endometriosis. Studies do show that women with endometriosis who work on pelvic floor function with a pelvic floor physiotherapist or physical therapist report improvements in pain intensity, physical function, and quality of life. So what are some action steps you can take if you suspect that pelvic floor dysfunction may be the reason why your pain persists? Well, first seek out an evaluation from a pelvic floor physical therapist or physiotherapist experienced with endometriosis patients. Engage in recommended exercises and therapies to relax and or strengthen the pelvic floor muscles. Inside the EndoThrive Society, we have an entire module built out by a pelvic floor physiotherapist. If you're looking for higher level support with the inclusion of pelvic floor support, I'll put the link in the show notes below. Okay, reason number 4 why your pain may persist postoperatively is that your immune system is involved in your pain picture. When your immune system is activated in response to something like menstruation, endometriosis, a high pain phase of your cycle, or an uptick in inflammatory chemicals like prostaglandins, it responds with an inflammatory response intended to activate a series of steps to resolve the problem. Your immune system also responds to nerve damage. Poor gut health, zinc deficiency, various nutrient gaps, low protein diets, low hormone production, especially estrogen and testosterone, hypothyroidism, and autoimmunity are all involved in how your immune system works. So some action steps to consider if you suspect that this may be part of the reason why your pain persists include things like avoiding nutrient gaps, a super simple intervention. A few vitamins and minerals to be extra on top of include vitamin D. So vitamin D regulates both branches of your immune response, the innate and adaptive immune responses. Low levels of vitamin D are linked to autoimmunity as well. Zinc is another important mineral, which is critical for T cell function, wound healing, and immune signaling. T cells are dysfunctional in people with endometriosis, so this is an important mineral to keep on top of to avoid further deficiencies. Iron is another important mineral to consider, and it's needed for function of the immune cells, and both deficiency and overload of iron are problematic. So don't just be taking iron as part of a prenatal or a multivitamin unless you know that you need it. Iron deficiency impairs innate immunity. Excess fuels oxidative stress, which is more of those pro-inflammatory DNA damaging unstable molecules compared to those anti-inflammatory inflammation fighting antioxidants. Selenium is another important mineral to consider. It supports glutathione production, which is your master inflammation fighter, and antiviral defenses. Low selenium is linked with increased inflammation and immune dysfunction. Plus, selenium is really important for converting your T4 thyroid hormone to your T3 active thyroid hormone. Omega-3 fatty acids help regulate cytokine production and lower systemic inflammation. Vitamin A and C support mucosal barriers in the gut, lungs, and uterus, and antibody production to keep you and your immune system healthy. In response to this action item, you can run a micronutrient panel or complement your diet with a quality multivitamin or prenatal. You've heard me say it 100 times before, but your largest immune organ is your gut. So optimizing your gut is a really important action item here, especially if there are indicators that your gut health is not optimal. This might include things like constipation, diarrhea, a bad taste in the mouth, bleeding gums, bloating, sticky or hard to wipe clean stools, abnormal burping, belching, and several other GI related symptoms. If you suspect an overgrowth of pathogens or a loss of diversity in your gut microbiome through a history with antibiotics or antimicrobials, we know that a lack of diversity in the gut microbiome impairs immune tolerance since, like I said, your gut is your largest immune organ. Increased gaps between the cells that line the gut, otherwise called leaky gut, allows toxins, larger food proteins, and bacterial components into circulation, so into your blood. And this can drive a lot of inflammation and be a potential trigger for autoimmunity. Short-chain fatty acids, a name that you might be familiar with, like butyrate, are produced by gut bacteria, and they help regulate certain cells of the immune system like T regulatory cells, and they help to boost your immune tolerance. So another really important reason to optimize the gut. We want to also work on resolving unresolved inflammation. Inflammation skews the immune response towards a pro-inflammatory state, and that can contribute to tissue damage, fatigue, and autoimmunity. Contributors to inflammation most within your control include diet, cooking methods, and interactions with toxins in cleaning products, beauty products, and those within your environment. I wouldn't suggest doing it all at once, but certainly slowly swapping out your cleaning products and your beauty products. I always start with removing or swapping the things out that go into your body. So things like your water, if you can get a good water filter in place to filter out any chemicals or hormones in your water supply. And so this is where you might consider your beauty products, anything that goes on the skin. And then lastly, we want to swap out things that are around the body, like air fresheners or cleaning products that might linger in the air at home. We also want to avoid synthetic ingredients in our food. This creates confusion within the immune response. Avoiding gluten or other possible sources of molecular mimicry, this is also a source of confusion within the immune response, might be a strategy you consider if you fit the bill. So one example here might be thyroid autoimmunity. If you have elevated thyroid antibodies, one strategy that is science-backed to work for many people with thyroid autoimmunity is gluten removal. I know it's easier said than done, but do your best to create a good, consistent sleep-wake routine that you can commit to, and as always, managing stress. Discuss with your doctor the possibility of treatments targeting the immune system, like low-dose naltrexone. I have a video on low-dose naltrexone that I'll link in the show notes below as well. Okay, and that brings us to reason number 5 as to why your pain may persist post-operatively. And this reason is that your surgery was not performed by a specialist. The success of endometriosis surgery can depend on the surgeon's expertise. Specialists are more likely to remove all lesions effectively. Many studies exist, as well as anecdotal evidence from experienced surgeons, that show the more experienced the surgeon, the fewer the complications, the better the outcomes, pain and fertility wise, and the lower the risk of complications. The action items here are pretty straightforward. You want to verify your surgeon's expertise and experience. You want to confirm that they're specialized in endometriosis surgeries. If necessary, seek out a second opinion from a recognized endometriosis specialist and ask the right questions. I have a really comprehensive blog on 25 plus questions that you can ask your surgeon that might help you feel better about moving forward with surgery. Okay, and reason number 6 that your pain may persist post-operatively is that hormones are playing a role in your pain symptom picture. Endometriosis is an estrogen-dependent condition. Even after surgery, hormone imbalances can cause symptoms to recur or to never improve in the first place. So what hormones play a role in pain and endometriosis symptoms? The first hormone I want to talk about is estradiol. Estradiol stimulates lesion growth and inflammation. Endometriosis lesions express high levels of aromatase. This is an enzyme that converts androstenedione and testosterone into estrogen, and it does so even locally at the level of the lesions. And this creates a pro-inflammatory and pain-sensitized microenvironment. Estrogen also promotes nerve growth into the lesions called neuroangiogenesis, and this increases pain sensitivity as well. Estrogen sensitizes nerves by enhancing expression of pain-related genes. An example of these genes include COX-2, PGE2 as well. High estradiol also increases mast cell activation, which contributes to pain and inflammation. You might be suspicious of this one if you also get those high histamine symptoms in those high estrogen phases of your cycle, like itchy skin, itchy eyes, runny nose, congestion, low-grade fever, body aches, and or rashes. The next hormone is progesterone. In a healthy cycle, progesterone is anti-inflammatory and helps counteract estrogen's effects. In endometriosis, tissues often become resistant to progesterone. You've probably heard the term progesterone resistance. This involves fewer progesterone receptors in the endometriosis lesions, reduced anti-inflammatory gene expression, and lesion growth and inflammation despite progesterone being present. Progesterone's involvement in the pain picture more so stems from the lack of proper progesterone response, resulting in uncontrolled inflammation, pain, and estrogen-driven lesion activity. The next hormone I want to talk about is cortisol. So chronic inflammation and stress from persistent pain disrupts the hypothalamic pituitary adrenal axis, otherwise known as the HPA axis. And this leads to lower cortisol output in some cases, which also results in a blunted stress response. The lower cortisol output can also alter pain perception and contribute to fatigue. Low cortisol results in reduced resilience against inflammation, increasing the perception and intensity of pain. The next hormone I want to talk about is androgens. So this includes your testosterone, your DHEA, your androstenedione, the characteristically male sex hormones, as you might call them. Testosterone helps control nerve sensitivity and reduces inflammatory signaling. Low testosterone, which is very common in endometriosis, may contribute to heightened pain sensitivity and fatigue. All estrogen, as we've established, is made from testosterone via aromatase. Aromatization of testosterone to estradiol further fuels estrogen dominance. And for more on that topic, I'll refer you back to when we discussed estrogen earlier in this video. Okay, the next hormone I want to talk about is prolactin. So prolactin is often overlooked in women with endometriosis, but it's also often elevated. And elevated prolactin increases pain and inflammation in a few ways. One is by acting as a pro-inflammatory chemical. Prolactin also encourages mast cell production. Prolactin also sensitizes nerve endings. Prolactin upregulates nociceptive pathways, which may increase pelvic pain, period pain, and non-cyclical pain. Prolactin also suppresses LH and FSH, which can suppress ovulation. This indirectly affects pain by suppressing progesterone production post-ovulation. Okay, so some action steps here. Naturally, you're gonna wanna have the hormone levels tested. Specific hormones are better tested at certain times in the cycle. I would test testosterone probably around ovulation. The second best time to test would be in the luteal phase. So that's the phase between ovulation and the start of your next period. For gauging your progesterone and estradiol, I would test those 7 days after ovulation. Prolactin is best tested in the morning. Any sort of breast or nipple stimulation will also stimulate prolactin production, even if you just take a shower and the water is falling on your chest. So you'll just want to be very, very mindful if you're having your prolactin tested to avoid any kind of sensation, touching, water falling on the chest, anything of that nature. Cortisol is really best tested in urine or saliva. The only way that a blood cortisol test will actually be a true reflection of what's going on is if you're getting to the lab very, very quickly within about a 20 to 30 minute window of the time of day that you're trying to assess your cortisol levels. Cortisol goes up and down throughout the day, so it's a bit hard to gauge in blood work. While each hormone has unique interventions that work, some foundational health habits for healthy hormones include getting really good sleep and establishing that good sleep-wake routine, eating enough throughout the day. Gosh, it is mind-blowing how many people I connect with in the endometriosis space who just simply do not eat enough. You want your blood sugars to be nicely balanced, which you can establish with the way that you structure and space your meals. So structure the meals to include a protein, fat, and fiber and space them 3.5 to 4 hours apart. You want to manage your stress. Your body ultimately has a choice when it's making hormones from cholesterol to shuttle resources towards progesterone production or cortisol. You don't want to be giving your body the signal that it needs to be shuttling more towards cortisol, i.e. through stress. You want your body to feel like it's not stressed, and so it can appropriately shuttle resources towards progesterone and cortisol if needed. You need several essential cofactors for making hormones. Some important ones are things like B vitamins, vitamin C, omega-3s, magnesium, and retinol, which is your active vitamin A. Exercise is really helpful for supporting hormone elimination and for balancing hormones, for supporting hormone production at the level of the ovaries and the adrenals. And you want to be experiencing joy. Giving your body that signal that you're joyful, that you're happy, helps with oxytocin production, and that really sends the right signals when it comes to producing healthy levels of these important hormones. Persistent pain after endometriosis surgery can be disheartening, but understanding the underlying reason is the first step towards relief. By addressing these 6 factors, or whichever ones apply to you, you can work towards a comprehensive treatment plan or management plan tailored to what you need. If you found this video helpful, please give it a like, subscribe for more endometriosis and fertility content, and share it with a friend. If you have any experiences or questions to share, you can drop them in the comments below, and I'll see you in the next video.